My name is Nikki and I've been a midwife for over 20 years now, and I have a particular passion with the fact of early pregnancy classes. I think it's an area which most women are very nervous about because they can't feel their baby move. They don't know if the baby's okay because they haven't had the first scan, so they have an awful lot of questions about it. And it's come up very obviously when I've worked with Tommy's a Baby charity and also with the various question and answers we get through Prima Baby, that this is an area that most women have a lot of questions on. Because of this, I have some particular tips just to advise you on to deal with the first trimester a little bit easier. With regards to tiredness that women get, this is normal. I think that's the first thing to say, and it's to do with the high levels of progesterone which act as a sedative, as well as your metabolic rate increasing by about 10 to 25%. Main thing is listen to your body, sleep when you can, it will pass by the 12 weeks, hopefully. The second hint is that when you have your first booking scan, take a photocopy of it and laminate it straight away. Don't let it languish because it can't be laminated itself. It has to be photocopied and then laminated, and it's the only time you'll get your whole baby in one little shot. So it's a very good tip. The other thing you should think about is when you have your vitamin tablets, make sure they're pregnancy related, because certain vitamins such as vitamin A can actually be quite detrimental in high levels, detrimental in first trimester. And try taking your vitamin tablets with some fresh orange juice, because it's going to aid the digestion of the iron. Avoid taking tea with your meals because this can prevent the digestion of iron. So just a little hints to help the vitamin tablets work a bit better. When you arrange where you're going to have your baby, think about your hospital visits when you're heavily pregnant and when you go in labour. It might be an ideal, nice hospital, but if it's middle of summer and you're going on 3 buses to get there, think again. Another hint that you might find helpful is when you're actually trying to find out when your baby's due, there's a way you can do it yourself without having to wait for the scan. Say the first date of your last period was the 1st of January, then add 9 months on, makes the 1st of October, and then add a week on top of that, 8th of October, that's your due date. So really easy for you to work out, have some idea, rather than just relying on the medical profession to tell you when your baby's due.